the normal bowel has 5 layers that can be seen in the sonographer. Okay, all the digestive system, stomach, esophagus, small and large intestine have the 4 layer. He is discovered of all the organ. Can be investigated as a large bowel and a small bowel or the digestive system in the body by using the proper probe. How can be chosen or the choice of the proper probe? It is dependent on the body habits. اختيارك للlinear probe, high frequency or the Kelvin dependent on the body habits or ما يسمى بالpatient weight. What is the 5 layer؟ عندنا 5 layer أساسية جدا، 5 طبقات تكون لي اللارج والسمول انتستين والستومك والاسوفيكس. ألا هي number 1 is called the mucosa. الميكوزا layer. What is the mucosa layer؟ mucosa layer he covered the organ from inside. معروفة إن هي أول طبقة بتكون موجودة في digestive system. Okay, for example the esophagus, the stomach, a large small intestine. Why? وظيفة الميكوزا layer he covered an organ from inside because prevent the organ from the damage. لأن الأورجن أو small, for example the small and the stomach he secretion the pepsin. Stomach secretion pepsin and the small intestine he receiver from the bile from the gallbladder and from the pancreas. والمادة الحامضة تعتبر هي مادة حارقة can be digestive of this organ، ممكن تأثر على الwall of this organ. ولهذا السبب توجد الطبقة الداخلية وهي الميكوزا. by ultrasound تعتبر هي الهايبر echoic layer، هي هايبر echoic. After that, combine between the 2 layer, mucosal layer and the muscular layer. He's called the muscularized mucosa. وهي hypoechoic. Second layer تعتبر hypoechoic. Number 3, the hyperechoic between the muscles and the submucosa والmuscular mucosa. He's called the submucosa by ultrasound detective of the hyperechoic. Layer number 4 is the hypoechoic and the strong layer in the organ. He's called the muscularized properia. is the hypoechoic وهي الطبقة العضلية. Last layer he covered the organ from the outside. The area of the accumulation of the fluid can be detected in the POCUS. ممكن نكتشفها في حالة الفاست exam by the increase of this fluid أو sometimes in the area of the hemorrhage. Okay, what is the last layer? This is a 5 layer and the hyperechoic the serosal layer. Okay, we'll see the ultrasound image. This is the 5 layer in the ultrasound. Number 1 the hyperechoic. Okay, this is a hypoechoic inside. This is maybe the fluid inside of this organ or the bowel. Number 1 the hyperechoic. This is the mucosa. And the hypoechoic, this is a mucosa and muscular layer combined together. Here a muscularized mucosa. Hyperechoic layer number 3, this is a submucosa, and the number 4, the hypoechoic and the large layer, the muscularized properia, and the last layer is the serosa, the hyperechoic. This is a serosa. He is a hyperechoic. Number 5 layer. He is called the hyperechoic, the serosa. Sometimes the patient suffering from the abdominal pain and vomiting, maybe sometimes the intussusception or the valvulus, or maybe the commonly the inflammation in the large or the small intestine. How can be detected with the inflammation? The inflammation of the large or the small bowel can be detected by the internal layer. The internal, who's the internal layer? Internal layer is the mucosa, may be inflammatory. After the mucosa is inflammatory، بعد ما يحصل لك التهاب في طبقة الميكوزا اللي بتسبب هي الاستفراغ أو ما يسمى بالمعوية بشكل عام sometimes، بتلاحظ إن في زيادة في السمك أو في السيكنس بين الميكوزا layer internal وهي ما يسمى بالكولايتس. end.